Now, for more on the reaction in the United Kingdom to the healthcare debate in America, we're joined by Andrew Clark. Mr. Clark is the New York correspondent for The Guardian, one of Britain's largest newspapers. Welcome.
Thank you. Nice to be here.
Well, all right. When Britons look at how the National Health Service has been made part of this sometimes even raucous debate in this country about healthcare reform, is the reaction in Britain one of bemusement or anger?
Well, I think it started out with bemusement and it's turning increasingly to anger. People are pretty perplexed at some of the language that's being used. Our healthcare system in the UK has been described as Orwellian, as socialist, even by some as evil in some way. So really what started out as a debate of how you pay for something has turned into something far more ideological, where it seems to have created a massive gap in understanding across the Atlantic.
What do Britons make of suggestions that the NHS would let people like Senator Kennedy or like Stephen Hawking die without getting any treatment?
I think that's caused a great deal of astonishment. I mean, for a start, it's simply untrue. Senator Kennedy, who's 77, would have had exactly the same treatment as a 77-year-old as he would have had as a 50-year-old or a 30-year-old. The only criteria applied would be whether his body is robust enough to take certain aggressive tactics. But really, I think people see that as an attack not just on the NHS but on the integrity of the UK. It's a suggestion that people in the UK don't care enough for elderly people, that they make these kind of brutal, ruthless judgments, death panels, as Sarah Palin puts it. And it's not the NHS that people know and understand in the UK.
Well, there has been suggestions that these attacks on the NHS have somehow managed to bring Liberals and Conservatives together in Great Britain. Is that true?
That's absolutely true. We had one outlier, one right-wing Conservative politician who I think made some comments on American television saying he'd rather have healthcare in the US, and he was slapped back into line very rapidly and very aggressively by the leader of the Conservative Party. There's a good deal of sensitivity about NHS spending in the UK because under Margaret Thatcher back in the 80s and 90s, spending was cut back quite heavily and services suffered. So the Conservatives are very keen to make clear that they would still guard the NHS. It would be safe in their hands if they were to win the next election.
I presume, though, that there would be Britons who say there are legitimate complaints against the NHS. Perhaps they believe that the US just has focused on the wrong things.
Absolutely, and that's what's so frustrating to many people. There are plenty of avenues through which you could attack the NHS. There are long waiting lists, there are poor screening programmes for things like cancer. It's no surprise that Britons have pretty bad teeth because NHS dentistry is not very good. And yet that doesn't seem to be enough, and certain people seem to need to go beyond that and start telling lies.
Andrew Clark from The Guardian, thank you very much.
Pleasure.